Hey everybody, it's Allie Molina. I'm gonna go ahead and do some peel pouches for you today. I got my 3 instruments that we're gonna go ahead and put in peel pouches. I got my indicator strips, my peel pouches, and my marker to be able to properly label the peel pouches, which you want to put your initials, the contents of the peel pouch, and the date it was processed. A couple things real quick. When you are doing peel pouches, you want to make sure to inspect your instruments to make sure that they are properly cleaned before you put them in the peel pouch to go be sterilized, as well as the peel pouches themselves. You want to make sure your peel pouches is not damaged at all. It doesn't have any tears, no nicks, no wrinkles or anything on either side of it, because it can damage the sterility of the instruments, and then you'll have to pack them and then send them off to the sterilizer again. So always inspect your pouches and your instruments. And also, I know these say that they have the indicator strip already on here. You do, however, want to still put your indicator strip in here, regardless if it says it's included or not. Always include your indicator strip. All right. So go ahead and start off with the Russian tissue forceps. Slide these over. So I'm going to inspect these to make sure they're nice and clean and ready to be sterilized. It doesn't seem to have anything wrong with it. What I can see, go in again, inspect my bag, my peel pouch. Now you see this one's nice and smooth. No little nicks that could have possibly happened. Same on the other side as well. So, and when you use peel pouches, you want to make sure you use the correct size. You don't want it to be too small to where it can't really get any movement in there, but you also don't want it to be too big to where the instruments are just floating around and can quite literally cause damage to the peel pouch itself. So like, for instance, this, way too big for this instrument. There's too much room left over. This will be flying around all up inside of this peel pouch, and it's possible it can cause damage to the pouch itself, which then you would have to reprocess. All right, so, and like this one, same thing. This one's way too small. It doesn't even fit. So I wouldn't use this size either. So when doing peel pouches, it is important to choose the correct size. You don't want it too big. You don't want it too small. You want it just right, to where it has just enough movement, not too snug, and for you to put the instrument in. All right, so I'm going to go ahead and slide these in. Now, peel pouches, they got the end that is to be peeled open by the end user, and this is the end that we are going to use because we are processing it. So we need to slide it in, and then we're going to go ahead and peel this all up. Nope, see, almost forgot. Indicator strip, I just said it. And then we're going to peel this off. And then on the pouches itself, it actually has a line where you can just go ahead and fold it over and then press it down. I'm going to do this on the table rather than holding it up, though, because you want to make sure to not have any wrinkles. You want it to be nice and smooth when you press it over. So go ahead and do that, just like that. See? Nice and done. You want to make sure, press it, not too hard where you don't rip it or anything, but you want to make sure it's nice and snug on there. And then we're going to go ahead and fill it out. My marker. This already says, this says the expiration date. I'm going to go ahead and put, today's date is I believe it is the 8th. Yes, it is February 8th. So I'm going to put 2. And then my initials, and they are Russian tissue forceps. You want to make sure everything is readable. That way, when they do pick it, they know exactly what it is. They don't have to try to guess what exactly it is. So, remember, It has enough room to move around. It's not too much room where it's just flying all over the package. It's not too little where it's about to burst through the seams. It is perfect. You have your indicator strip. You closed it properly. No rivets or anything in the closing process. And then we initialed, date, and labeled what the instrument is. So then we're going to set this aside. There's one. All right. Next, we got our Forester sponge stick. So again, I'm going to inspect these to make sure they're nice and ready for sterilization. You want to make sure to look at all of these, and because these have ratchets, you want to check them as well. The Russian tissue forceps did not have any type of ratchet whatsoever, or even the rings. So this one we're going to look at a little bit differently. So I'm going to look at the box lock, the tips, the rings, and the ratchets, the shafts, all of it, and the jaws. Make sure everything is nice and ready to be sterilized. This looks pretty good to me. All right, ratchets too. And another thing with the ratchets, to make sure they stay in place, is you want to tap them a couple times. And if they stay in place, then they're perfectly fine. If they do not stay in place, if they overlap, if they move, if these don't align, then you would have to remove this from service and get it fixed. So we're gonna, all right, pretty good, stays in spot. All right, we're gonna open that back up. Now I'm gonna choose the right one for this instrument. Now, if you're unsure, you don't ever put any instruments on the bottom side of your peel pouch. If you're gonna set them on the peel pouch, set them on top, the plastic side. And this way you can, like, you know, double check, make sure, because you want to have all your hinged instruments open. That way all of the instruments get sterilized in the sterilization process, rather than if it's closed, the inside of these teeth are not going to get sterilized because they are in fact closed. So you want all your hinged instruments open. All right, so, and as well, you also want the rings to be towards the chevron, the side where the end user peels it open and goes to use, because you want them to grab the rings, not the tips. You don't want to be touching the tips that is going to be physically come into contact with any patient's skin or fluids or body parts whatsoever. So you don't want to package them like this. I'm going to show you what not to do, and then I'm going to show you what to do. So this one is actually the 5 1/4 by 10, which honestly I feel like it's too small, because first of all, it's coming too close. So I would probably go ahead and use a different size, just because. This is good. All right. So we're going to use the 7 by 13. So what you don't want to do is you don't want to put them in like this. You want them open, but you don't want it to where your end user opens and has to grab the tip. You want them to grab the handles, the rings. So I'm going to take them out. Remember to leave them open. You want it open. That way all the insides of the box lock and the serrations over here, as well as all the ratchets, can all get sterilized properly. Slide them on in. All right, we got not our indicator strip, because that's from trash. Indicator strip. And you want them to be able to see it as well. They don't need to search and find their indicator strip. You want it right on top and then open. And then we're going to go ahead and peel this. Slide it from the center outward. You want it center outward. That way it's nice and aligned, rather you go from tip to end, and this side's more overlapped, and it messes with the process. All right, today is the 8th. My initials, and these of the Forster sponge stick. Forster sponge stick, name, date, indicator strip. Alright, here's 2. Now, so what I did do, and I chose this purposely, because I do not have the items needed to really put these in peel pouches, but I wanted to use them anyway, because having to use tip protectors, tip guards, or anything like that, tip covers, it's used very often in the processing of peel pouches. So I went ahead and chose an instrument that will require tip guards, even though I don't have them, just to show that these do in fact need the extra protection to make sure it does not damage the peel pouch itself. So here we have our Mayo scissors. Scissors, you're going to typically use tip guards because, again, they're sharp and they can cut and damage the plastic of the peel pouch. So, again, I do not have this at the moment, but I am still going to show how you would process these, even though I do not. So, in a perfect world, you would put tip guards, and if you don't have the tip guards, you can use the tip protector. So it's like a paper. You slide it in, and it's got a little ring on top. Clear protector right here, so it's over the scissors itself, so it's not going to come into contact with the paper whatsoever. And then this little hook, snug latch that you would just wrap under, and then you would take it after you inspect them. You want to inspect your box locks, your rings, your shafts, your tips, all that. You would, again, choose the appropriate size. I'm going to choose the, realistically, I would need to use a bigger size because I would have a tip protector on here, and it would be about the same size as this one, as the 5x10. So I'm going to go ahead and use the 7x13 again. And again, you want to make sure to put the rings by the chevron. The tip where the end user opens the package is the chevron. That's where you want your rings. You do not want your end user to grab the tips of the scissors. One, it's very dangerous. They can hurt themselves, cut themselves, and then cause problems there, as well as you don't want your surgeon to be grabbing this end that's going to be inserted or used anywhere near or inside of the patient, because who's to say they didn't scratch their nose or something and then they go ahead and grab this. You can cause cross-contamination, and it's just a big no-no. We don't want to do that. So, again, tip protector would be used for the scissors. I don't have one, but I am still going to process this. So tip protectors would be used for your scissors. You want the rings towards the chevron. You put your indicator strip in where it can be seen. Then you would close it. Peel that off. Nice and snug. Get that nice. See? Nice and good. Alright? And then we're going to go ahead and write on here. All right. There you go. Scissors, Mayo scissors, AM, and today's date. And again, this one already comes with the expiration date on it. So you got an indicator strip. Again, this wouldn't be flopping around like it is right now because it would be on a tip protector, which would take up a good bit of the space that this is missing. But this would be a size that I would use for these scissors because, again, when using the tip protector, it's about the same width as the 5x10, so you would go ahead and use a bigger size. All right, and that's it. And then these would be sent off for some sterilization. So, thank you guys.